Only in America.
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 This week, as we celebrate Asian Pacific American Heritage Month, a public health expert explains the unique healthcare challenges these communities face and the incredible contributions they're making amid the pandemic.
If some of the healthcare providers, especially in rural areas, weren't there, what would those people do? Especially if it's like a 50, 100, 200-mile radius that there's no other physician. I'm not quite sure, especially in these times of COVID, that don't pay attention to socioeconomic status or immigration status or racial background or where you live, rural or urban. I worry for those communities if that kind of thing continued to play out.
And a nurse on the front lines of the pandemic shares her immigrant experience.
And different talents are coming here, different job opportunities. So everything, they see to it that U.S. is the source of all these opportunities, that every people here, they're all equal. Nobody is, ahead, even though they are born here. You got the same opportunity.
From the National Immigration Forum, I'm Ali Nirani, and this is Only in America. As the fight against COVID-19 continues, healthcare workers across the country are on the front lines responding to the pandemic, often risking their own lives in the process. And many Asian American and Pacific Islanders are leading this fight. They play an outsized role in our nation's healthcare system. Nationally, 21% of all physicians and 10% of nurses are Asian American. It's clear that these workers, whether they are recent immigrants or their family has been in the U.S. for generations, are vital to keeping our nation healthy. But the continued politicization of this pandemic has created another painful challenge: the rise of anti-Asian xenophobia and racism across the U.S. As anti-Asian rhetoric stokes fear and division across the country, Asian American communities face the double-edged sword of a dangerous virus and dangerous hatred. Even when infection rates subside and life begins to resemble normalcy, the lingering effects of xenophobia will take much longer to fade, and the communities it targets will take much longer to fully recover. Allowing the challenges and grief of the pandemic to stoke hatred and division will not make any of us safer. Overcoming COVID-19 will take all of us, no matter our race, nationality, or immigration status. Kathy Ko-Chin is acutely aware of the contributions of AAPI communities and the challenges they face these days. As president and CEO of the Asian and Pacific Islander American Health Forum, Kathy leads a national health justice organization in advocating and mobilizing to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. She also served on President Obama's Advisory Commission on Asian Americans and Pacific Islanders. The child of Chinese immigrants, Kathy grew up in the Midwest and now lives in the Bay Area. Kathy and I spoke about the role of Asian American and Pacific Islander health workers in the pandemic response, the unique healthcare challenges some immigrant communities face, and how to be a better bystander if you witness xenophobia.
Well, first and foremost, I identify myself as a child of immigrants. My parents are both immigrants originally from China via Taiwan and came in the 50s, both as students. And I'm the first born on both sides of my families to be born in the United States. And that's reflected in my name, as well as all the aspirations my parents had for me. So just being a second generation Chinese American from Cleveland, Ohio, raised in the 60s, there really is a perspective, I think, that is different from where I now live, which is Oakland, California. And then we also at the Health Forum have a DC office. So I think there's, a high concentration of Asian Americans in both coasts, with 5, 6 generations of Asian Americans living on either coast. But for those of us from the Midwest, it is a really different experience. And what I find as I travel across the country, visiting with our partners in the 35 states and across the Pacific, where we have community organizational partners, is that for many, many people, it's a very similar experience. Maybe not from the 60s, but a very similar experience of being isolated among very few and not very understood, and really not necessarily always having the access to services that they need. So let me just fast forward and tell you a little bit about the Health Forum. So the Asian and Pacific Islander American Health Forum, where I am president and CEO, is the nation's a clear, strong voice on the health of Asian Americans, Native Hawaiians, and Pacific Islanders. And we connect our communities from all across the country to the highest levels of government, whether it be Congress, the administration, or as needed, the Supreme Court. So it's quite a privilege to serve as the leader of the organization, and we are connected to so many different stakeholders that help advance health equity.
I want to come back to the theme of isolation because I think it plays out in such powerful and clear ways today, but we'll come back to that. I was wondering if we could start the conversation as we get into the substance, the role that the Asian American Pacific Islander community is playing in our healthcare workforce today.
That's a great question. So here we are I think in the Bay Area, we're in week 10 of shelter in place. And of course, COVID-19 has affected the entire nation and the entire world. And here in the United States, we really do have major contributions in the fight against COVID that are really disproportionately being held up by Asian Americans, Native Hawaiians, and Pacific Islanders, whether it be in the fields of research and vaccine solutions, or health providers in the healthcare workforce. So 21% of all physicians in the United States are Asian American. Nearly 10% of registered nurses are Asian American. And just here in California alone, 18% of the nurses in California alone are Filipina. So you can see that this is a really high proportion of how Asian Americans, Native Hawaiians, and Pacific Islanders are leading the fight against COVID-19. We also have some stories from the ground that we've been hearing about how heroic our healthcare workers have been. So a physician at Mount Sinai in Queens, really in many ways ground zero in the country for the COVID epidemic until most recently the Navajo Nation stats, but certainly in New York City, Dr. Bai is living apart from his wife and 17-month-old child in order to continue to serve, but to also protect his family. Or Nurse Trey Kwan, an ICU nurse in New York, who was pregnant and had a baby and was planning on taking 5 to 6 months off for maternity leave, but really responded to the call of duty and call of responsibility to go back early and support her coworkers working in ICU, really taking care of the sickest patients. So as you can see, not only are there a large proportion of Asian American, Native Hawaiian, Pacific Islanders in the healthcare field, but also really responding and taking responsibility for how to respond on the front lines for COVID.
And this is all happening in the context of a deeply politicized pandemic where we have an administration that seems to be more than willing to, lead a segment of the country to believe that, one particular community is responsible. So some are call this the second virus, so xenophobia and anti-Asian discrimination. How is this playing out for the community that you represent and you work with?
That's a really good question, Ali. So it's on many levels. So if we just think about interpersonal hate-motivated incidences, there have been officially reported 1,500 reports of hate-motivated instances against Asian Americans and other people of color, but in particular Asian Americans, with 2/3 of them being women. And so this racism, the anti-Asian hate, really is stoked further by the anti-Asian rhetoric from our highest officials, as well as different campaign ads, and then also the kind of rhetoric that we're hearing just across the country. So this backlash of hate crimes and incidences are very personal. A friend of mine was walking down the street in San Francisco and got spit on. And that's just kind of inconceivable in a place like San Francisco, but it happens. And at the same time, at the policy levels, we are seeing the anti-Asian hate really playing out that's historical. So whether it be from 1882, the Chinese Exclusion Act, in the 1940s during World War II, the Japanese American incarceration and internment, or the murder of Vincent Chin in the 1980s, as well as the anti-Muslim and anti-Brown hate from 9/11. This narrative and the experience of Asian Americans, Native Hawaiians, and Pacific Islanders all across the country is a continued narrative with different times of greater volume and intensity. And this is certainly one of those times.
Rural, suburban parts of the country are also disproportionately reliant on an immigrant healthcare workforce. So I was wondering, in your travels and your conversations with your membership, do you see a difference between the way that the AAPI community is seen and valued in a rural healthcare setting versus an urban?
Yeah, I think that's a really good point. I actually read a really poignant story in the New York Times a few years ago about this South Asian physician who was Muslim, and he was the only doctor in like a 200-mile radius. And he had developed such a close relationship with all the patients he took care of. But as the anti Muslim hate really rose again after the Muslim ban, the travel ban in January of 2017, he had to start wearing like bulletproof vests, and he wanted to go out into the community to talk about like how his community is contributing. And that, for me, cognitive dissonance is so poignant because if some of the healthcare providers, especially in rural areas, weren't there, what would those people do? Especially if it's like a 50, 100, 200-mile radius that there's no other physician. I'm not quite sure, especially in these times of COVID, that don't pay attention to socioeconomic status or immigration status or racial background or where you live, rural or urban. I worry for those communities if that kind of thing continue to play out.
And on the other hand, to be a little bit more optimistic about it, is that in this crisis, it's also an opportunity for rural communities to rely on one another in a completely different way. Like you said, irrespective of immigration status, race, ethnicity. So there's a real powerful opportunity in this horrible crisis.
Absolutely.
And what are the challenges that the API communities face in accessing healthcare? But then also these days, in the face of COVID-19, how are those challenges in terms of access to services even worse or exacerbated?
Yeah, there are many of us in across many communities of color that have talked about how if we ever thought there was a safety net, or if we ever thought that our communities were really getting the kind of access to care that they needed, COVID has really revealed that not only was that a figment that we have a safety net, but that this is not just holes in a net. These are chasms that were already existing. So for the Health Forum, we're 36 years old next year, and we have been fighting the same fight for all 30 plus years around language access, around barriers to health for immigrant communities, both coverage as well as by immigration status and residency status, as well as the lack of data to actually even direct us to where there are health disparities that need to be addressed. And so in this moment of pandemic, all of these structural issues are revealed all the more dramatically in a much more stark contrast to what we would rather see happening. So in the language access part, there are over 61 million in the country who speak a language other than English, and over 25 million are limited English proficient, with a full third of APIs who are limited English proficient. And in general, when disasters happen, FEMA has the capacity to translate in 19 different languages. But because of the lack of organized response at the federal level for quite a long time, then that infrastructure was not able to be activated. And so we went a really, really long time, all of March, well into April, and even into May, without the basic information around prevention, hand washing, sheltering in place, physical distancing, why we're sheltering in place, why schools are closing. We didn't have any of that in any languages, not even Spanish or even other common languages. So many of us in the community have had to step up to really try to address these gaps. So for example, our partners in Arkansas, the Arkansas Coalition of Marshallese, they had to hold an emergency fundraiser to raise funds so that professional translators could be accessed to even identify what are the symptoms to look out for so that people could take the precautions that they needed. And then issues like if you are uninsured and you remain uninsured because of your immigration or residency status, how do you know that going to get tested or even the care that you will need if you come down with COVID, that that's going to be covered? And does that create a chilling effect and another aspect of not controlling the disease? So we really have looked at needing to make sure that public insurance covers all residents of the United States, regardless of immigration or residency status, and to make sure that testing and care for COVID is going to be covered. In addition to that, the administration last October issued new regulation called public charge that says that if you use public benefits, including Medicaid, public health insurance, that it can be used against you on your immigration status. And that created a chilling effect. So there is a call to lift the public charge regulations, certainly during this time of pandemic, so that people aren't scared of seeking out treatment and testing, or even of doing contact tracing. And then lastly, the area of disaggregated data. So in the Asian American, Native Hawaiian, Pacific Islander communities, quite often data just lumps us all together. And as we've seen across the country, the pandemic is affecting communities of color in a disproportionate way, with both infection as well as, unfortunately, mortality. And if we don't have the data collected by race and ethnicity, we won't know how best to treat it. So there have been calls through Congress, there have been calls at the federal as well as state level for collecting infection, morbidity, and mortality data by race and ethnicity. And that's the only way we're really going to know where it's hitting our communities and how to do something about that in a more proactive way. In the Asian American, Native Hawaiian, Pacific Islander communities, it's so important that we also collect, analyze, and report on data by specific ethnicities, because not only are we looking at the racial and ethnic components, but also primary language. And because so many of our communities are limited English proficient, we need to know how best to deliver those messages in the right languages so that people can understand and take the right preventative measures. So the collection and reporting of that data in this, what we call disaggregated fashion, in other words, showing it by individual ethnicity or nationality, is so important in our communities.
Over the course of the pandemic and the response, has there been a news story or someone you talked to who's serving the community that has just surprised you and said, you know what, I did not expect that?
I think what has surprised me is how many people of goodwill have really stepped up. So, of course, frontline healthcare workers, it is, for physicians, they take a Hippocratic oath. Many of us in health and public health, we realize that in times of crisis and pandemic, this is our time. We have to step up. My husband is a retired physician's assistant, and he applied to join the medical corps here in California. But so many other people are stepping forward, whether it's to sew masks or to, my son is volunteering at a homeless shelter to make food, in very many ways to really support each other, because that's the only way that we're going to be able to get through this pandemic. Is really a moment to not think of the division that is being stoked at so many levels across the country, including in the highest levels of our leadership, but really to think about how this moment can bring us all together. And that really by coming together, showing each other our humanity and our compassion, that's really how we're going to get through this. And so that, in many ways, it hasn't surprised me, but that is what has brought such joy, to hear those stories of people coming together across so many different demographic differences, geographic differences, even political differences, to say, this is how our whole country responds, and this is how we need to respond together to really overcome this pandemic.
Because going back to your first answer, that feeling of isolation, growing up in the Midwest, it would be very easy to assume that in this moment, we could all feel incredibly isolated from one another because, frankly, we're supposed to be. But like you said, there are these moments now where people are breaking through that isolation in just incredibly inspirational ways.
Thank you. Yeah, another resource that I do want to share with your listeners is in the face of the anti-Asian hate. There are a number of trackers and reporting websites where people can go to report any incidences that they have experienced. The one that we refer to is standagainsthatred.org, and that is offered by Asian Americans Advancing Justice, the Asian American Justice Center. In addition to that, AAJC has this amazing bystander training toolkit and training. So the toolkit is available at standagainsthatred.org, and it's really tips for how you can show support. Right now, we're all isolating and sheltering in place, but many places are starting to reopen. So as that happens, we are anticipating more instances because there'll just be more contact, more instances of anti-Asian violence and hate. So how can I be a good bystander to help show support to somebody who might be experiencing that kind of incident? And you want to be careful for yourself. You don't want to get overly involved, but what might be small things that one can do, even to just ask them if they're okay, or stand closer to them if you're on, let's say, public transportation. AAJC is also offering trainings that you can sign up for at that website, and they're training as many as 1,000 people each training, with a couple, 3 trainings a week. So there really is, again, people of goodwill coming forward to say, I don't want to stand by to see anti-Asian hate happening. How can I learn to be a good ally? How can I learn to be a supporting bystander and really try to counter the kind of anti-Asian violence and hate that's happening?
And my last question for you, it's a question that I ask of all of our guests, is just to finish this sentence. Only in America, ...
Only in America could a child of immigrants from China have an opportunity to be on this podcast, to talk with you, Ali, and to really think about how our nation moves through this pandemic, becomes stronger by coming together, and to really reach so many people with messages about how important immigrants have been and will continue to be to our nation. Thank you.
Thank you so much, Kathy. That was spectacular. Thank you.
Thank you.
Support for the National Immigration Forum comes from the Carnegie Corporation of New York, supporting innovations in education, democratic engagement, and strengthening international peace and security. And from Humanity United. When humanity is united, we can bring a powerful force for human dignity.
One of the Asian American healthcare workers making incredible contributions to our country is Rosalie Villanueva. Although Rosalie is currently on the front lines of the pandemic response, I had the opportunity to speak to her last year about her immigrant experience. Originally from the Philippines, Rosalie's qualifications allowed her to move to the United Arab Emirates to work as a nurse. Rosalie later immigrated a second time, settling in Texas with her family. Her story was profiled in my friend Jason DeParle's book, A Good Provider is One Who Leaves. Rosalie and I discussed the sacrifices she made for her family, how she adjusted to life in the U.S., and the opportunities the U.S. provided.
I started in Texas, and then Mylene came over, and Galen came over to Texas also. Mm-hmm. Yeah, I think it was the offer that came to me. Maybe it's the right timing also, because my agency offered me also from Arizona or California, but they said Texas is better with the weather and the cost of living, Mm-hmm. So, and I find it, when I came here in Galveston, it was really so sad for me, because I felt like it's an island or something with the ocean, so I got scared, but I got used to it now.
Do you see Galveston as home now?
Yeah.
When did it become home?
When I adjusted already with my family, and I never thought that my husband would like it, so he liked it more than I wanted. So he said he likes living here, because I was expecting, big buildings like in New York, and then it was a little bit like a county, like a province. So I like it. It's more peaceful. It's more, I think, calm than a big city.
And how do your kids like it?
Oh, my kids like it also. Yeah, they enjoy the place because they were very near to Houston and they like Houston. We have Jollibee here, which is famous in the Philippines. Then we like it here. There's a lot of Filipino stores here. Yeah, a lot of Filipinos here. Also, our friends also. We already make a group here, Filipino group. So, even though my parents and my siblings is not here, so we have a family with other Filipino friends here. So, yeah.
And do your children have friends who are outside of the Filipino community?
They have in the school and in our community, or my colleagues in the hospital. I have also Filipino colleagues. They have children, so we usually meet on occasion with birthdays and parties. So yeah, they already also like a friends. Yeah.
What do you want for your children? Let's say we're having this conversation in 15 years. What would you like for your family in 15 years?
I like my children. They're already finished their college. They have a stable job. Yeah, they've been working. Yeah. And probably just my husband and I will be left,
Retired and
retired, yeah, and just go back in there,
How often do you go back to the Philippines?
Now maybe every 3 years. Yeah.
Less often than.
Yeah, less often. Because unlike when I was in UAE, it's much like every year. But since it's too far, like 24 hours of travel, it's tiring.
And it's expensive
And
too.
it costs a lot of money for us because we're 5.
Right.
Yeah.
What do your kids think when they go back?
They're so excited to see the Philippines again.
And do you think that the opportunities your children have had, you've had, your husband has had here in the United States, would they have been possible if you'd stayed in the Philippines?
No, it's not. It's impossible because I could not get a good paying salary in the Philippines right now, although they're trying to raise the pay of the nurses, but here in US is still different. You have more freedom in your workplace. You can get 2 to 3 jobs. You can have a good paying job. Yeah, they pay you better.
What's the most surprising thing about the United States?
The
Or
taxes.
The taxes.
Yeah, when I came here, I was really confused with the taxes, everything. That everything you need to have tax. You need to have insurance. Yeah, a big adjustment, but I got used to it now. I learned. Before, I couldn't really figure out how to do and now understand.
What would the people who read this book, A Good Provider is the One Who Leaves, what would you like them to learn?
I think I'd like them to see it as my journey. It's not only I have this kind of journey. I know a lot of Filipinos and overseas workers having this journey. It is the love for your family, your sacrifice that you have done working outside your country, far from your parents, your sibling, just to, able to help your family, sustain your family, and give them better, future. So supporting them. It's all for my family and my kids. Yeah.
And what would you say to the person who says, the United States doesn't need any more immigrants?
I don't believe in that because immigrants is it's a global thing and it's a continuously going. There's somebody coming, go, leaving, who's still coming. So you cannot live by yourselves alone, I think. So other people, different nationality, they have different opinions. And U.S. is, like a melting pot of all the different cultures, and different talents are coming here, different job opportunities. So everything, they see to it that U.S. is the source of all these opportunities, that every people here, they're all equal. Nobody is, ahead, even though they are born here. You get the same opportunity as they enjoyed with a citizen here.
Yeah. I think you said something very important in that immigration is global.
Yeah.
I mean, your story is very global. Your connection to your friends is very global. And I don't think Americans realize that.
I think, for those people that they have some bad experience regarding immigrants, those who are really gave threat to this country, probably. Yeah. Those who are not helping also this country, but just relying on this country only. Some people came here for some purpose. But there are people who came here for opportunity and they're able to contribute to this country also.
What do your patients tell you if they learn your story that you're from the Philippines?
They like it, They don't have any, discrimination or anything bad thoughts about being me. Because I got one patient that when she asked me where did I came from, and I said from the Philippines, and she said, yeah, I know you came from the Philippines, and she thought that most Asian, they care a lot to the patient. They're more caring, compassionate to patients.
So my last question for you. The name of the podcast is Only in America. So just to finish this sentence, only in America, ...
Only in America I can find good opportunities for me and my kids. Only America I can find equal opportunity for equal people, where people are treated as the same.
Thank you.
Yeah.
Thank you so
Welcome.
much. Thank you. Kathy Ko Chin is President and CEO of the Asian and Pacific Islander American Health Forum. Rosalie Villanueva is a registered nurse working in Galveston, Texas. You can find more information about Kathy and Rosalie at our website, immigrationforum.org/podcast. And while you're there, subscribe to Only in America to catch all the latest episodes. Tune in next week to hear what's next in our series, Keeping Us Healthy. Only in America is produced and edited by Joanna Taylor and Megan Wetmore. I'm Ali Nirani, and I will talk to you next week.